I'm Augie Galindo. I'm one of the owners of Testosterone Centers of Texas. The difference between low libido and ED is very important. This is something I cover with my patients anytime that I see either one of these symptoms circled when we have our initial intake sheets done. And I'm big on analogies, so just kind of walk through this with me. If you like cake, let's say cake's your favorite dessert, because I don't get to actually ask you this question, but if you like cake and it's been a crazy morning and day for you, so you woke up, had to jump into work, and you skipped breakfast, you've skipped lunch, it's 3 o'clock in the afternoon now, you're starving, somebody puts your favorite cake in front of you, and you could devour the whole thing in 5 minutes. 30 minutes later, somebody comes in and offers you a slice of the same cake. You're likely inclined at that point to say, no thank you, I'm good. At that point, you're full, you're sated, you don't have that internal desire to consume more cake because you're just bloated from consuming the whole cake before. At that moment, you didn't decide that that's not your favorite dessert. You didn't decide that cake's not something that's good. You just don't have an appetite for it. So in this scenario, we're talking about an appropriate appetite, right? But if you have a internal desire for intimacy, an internal drive toward intimacy, that is what your libido is. That doesn't mean somebody just asked you the question, do you like sex? And you answer with a resounding yes, because you could have an absence of that appetite, but still process the question the same way. So it's more than that. It's that internal desire toward intimacy. That's how I classify your libido. And so if you have a decrease in that, if it's something that has led to fewer or less invasive thoughts, because just studies have shown that we should have at least a few invasive thoughts about sexual things throughout the day. And again, that should be put into a classification of we're wanting a healthy appetite for these things. But that's something that we look to identify a decreased libido. Now, you could have a libido that's completely normal. That it may have been unchanged from your late 20s, early 30s, and now you're in your 50s. But you could have a change in the way the biological response happens to that normal libido. And so this is where erectile dysfunction comes in. And erectile dysfunction, like most things in life, exists on a spectrum. You could have something that's severe where you're unable to obtain an erection under any circumstances. And then you can have something much less serious, but still impactful, where you have every ability to obtain an erection. You don't have any issues getting the process started, but perhaps you're not getting a strong erection, or at least as strong of erection as you had in the past. So if it's a duration issue, if it's a strength of erection issue, that still falls in the realm of erectile dysfunction. And then of course you have everything in between. You can have those intermittent times where you're unable to obtain an erection or maintain an erection throughout intercourse, but that doesn't necessarily happen every time. So you can go from complete inability, and you can go from an occasional quality issue, and then everything in between. And so the main difference there, just to summarize, a decreased libido is a reduction or absence of the internal drive toward intimacy, and changes in erectile function happen along a spectrum that can be anything from mild ED, which are quality issues, all the way up to complete erectile dysfunction where you don't have any ability to obtain an erection at all. Treating low T can help with ED. In fact, studies show that you will have a synergistic response if you're using medications that are commonly used for erectile dysfunction, like Viagra or Cialis or Levitra, in combination with TRT. But even further, I would say that some patients of mine who have been on those medications prior to coming to see me were able to stop using those medications because their more mild ED symptoms were treated simply by correcting their testosterone levels. But whether it's removing your need for the other medications or having a better response with those medications because there are other internal issues that are affecting your erectile function, TRT does improve ED alongside either treatment with what are phosphodiesterase inhibitors, so the Viagra, Cialis, Levitra, or not using those, you'll still have typically an improvement in erectile function. TRT and ED treatments can definitely be combined. It's something that is taken as a stair-step process. If somebody is already on medication for erectile dysfunction, when they come to see me, I'll typically leave them on it, but then let them know that as we start TRT and optimize their levels, they may see a reduction or even a resolution of their need for that medication. And then beyond that, we can also add that in if at any point during the course of testosterone replacement therapy. I am Augie Galindo. I'm one of the owners of Testosterone Centers of Texas. Thank you for listening and watching, and if you would like to learn more, go to tctmed.com.